Good day! We will be presenting our mini project entitled A Comparative Study on Lung Cancer Prediction Using Naive Bias and Logistic Regression. This is the outline of our presentation. First part is the introduction. The researchers will implement and compare ML models that can identify an individual's likelihood of developing lung cancer, which can be treated if identified and diagnosed early. Specifically, the researchers will train a logistic regression and a naive Bayes model to predict likelihood of lung cancer, compare both of their evaluation scores, as well as determine the top 3 factors for people with high likelihood, medium likelihood, and low likelihood of contracting lung cancer. The following are some of the relevant literature and previous work in the area. For the hypothesis, the researchers will not be able to implement a ML model. Moving on to the methodology. The dataset that we use is the lung cancer prediction dataset in Kaggle of the user Devastator, as can be seen below. The dataset includes background information such as age, gender, exposure to air pollution, etc., as well as data of lung cancer symptoms based on severity. Patient ID, frequent cold, snoring, and dry cough were not included in our study. The remaining columns, excluding level, are features that are of interest, while the level column values as the true label. 75% of the data is for training and 25% for testing. The ML models are logistic regression and naive Bayes, wherein they were compared. For the results,
The following results were found in the study. For the logistic regression model, it had an accuracy score of 99% on the training set with macro averages of 99% in precision, recall, and F1 score respectively. Here is its confusion matrix for the training set. For the testing set, it had an accuracy score of 98% with macro averages of 98% for precision, recall, and F1 score respectively. Here is its confusion matrix for the testing set. For the naive Bayes model, it had an accuracy score of 85% on the training set with macro averages of 85% for precision, recall, and F1 score. Here is its confusion matrix for the training set. For the testing set, naive Bayes had an accuracy of 85% and macro averages of 85% for precision and 84% for recall and F1 score. Here is its confusion matrix for the testing set. When comparing the two models on the training set, logistic regression had gained a higher score in all metrics than naive Bayes. Logistic regression also gained a higher score than naive Bayes in all metrics in the training set. Using the weights formed in the logistic regression model, the features were analyzed and it was found out that in individuals with high risk of lung cancer, that their top 3 features with the strongest correlation are exposure to air pollution, fatigue, and passive smoking. Individuals with low risk of lung cancer, their top 3 features with the strongest correlation are fatigue, clumping of fingernails, and wheezing. For individuals with medium risk of lung cancer, their top 3 features with the strongest correlation are fatigue, passive smoking, and coughing of blood.
We will now move on to discuss our conclusions and our recommendations for this study. Moving on to our conclusions, after successfully implementing logistic regression and naive Bayes to identify the likelihood of contracting lung cancer, we found that logistic regression offered the superior model. We were also able to identify the top 3 predictors for having a high, medium, and low risk of developing lung cancer, with fatigue being the overall best predictor. For the future, we also recommend that other researchers try testing other models and unexplored columns from the original dataset, along with larger datasets with more features. We also recommend looking further into the features with strong correlations with the risk of lung cancer to try and identify the underlying causes. Thank you.